Good morning, Dr. Jefferson. Good morning, class. My name is Ruth Emmanuel. I'll be presenting a project topic on preeclampsia, pregnancy-induced hypertension. Let's look at the definition of preeclampsia. Preeclampsia, or toxemia, as you may call it, is a potentially life-threatening condition that usually develops late in the second trimester or third trimester of the pregnancy. This condition puts moms and babies at much greater risk for developing complications during the pregnancy. Examples include kidney failure, liver impairment, and seizures, and finally preterm babies. What I mean by preterm babies is these babies are delivered before full term, as we know that full term babies are 40 weeks. So when we mean preterm, they could be delivered from 20 weeks of pregnancy, depending on the development of the fetus. Let's look at the etiology. The etiology of preeclampsia is not known. The cause of this disease is not known, but several factors experts believe, according to mayoclinic.org, it begins in the placenta, since we all know that placenta is the organ that nourishes the fetus. This placenta sends blood to the fetus. So what we know that if early in pregnancy the new blood vessels develop and evolve efficiently, sending blood to the plasma, but in women with preeclampsia, these blood vessels don't seem to develop or function properly. They are narrower, and normal blood vessels and they react differently to hormonal signaling, which limits the amount of blood that flows through them, causing all these abnormalities during the pregnancy. So let's quickly look at the prevalence. How common is this disease? It is more prevalent in Black women. When we look at the race, it is more prevalent in Black women. They are at high risk of having preeclampsia than women in other races. Another common where we could find preeclampsia, where it's common, is in people that have multiple pregnancy. What I mean by multiple pregnancy is women that have more than one baby, like twins, triplets, quadruplets, and octuplets. Those kind of women are at risk for preeclampsia. Another is the history of preeclampsia. If you have a person or a family of preeclampsia, it significantly raises the risk of having a preeclampsia. More so if you have chronic hypertension before pregnancy, this definitely will put a woman at risk for preeclampsia. Let's look at the diagnosis. In order to diagnose preeclampsia, some tests needs to be done, and this is the doctors will prescribe all these tests and will be conducted. Blood test to measure platelets, 24-hour urinal test, urinalysis test to measure the amount of protein in the urine, fetal ultrasound to closely monitor the heart rate of the baby and the growth, and more so the amount of amniotic fluid in the uterus. A non-stress test could also be used to check how the baby's heart rate reacts when the baby moves. So most so to diagnose preeclampsia, the mother have to have a high blood pressure of more than 140/90 in not in one reading. One reading could not determine that a woman has preeclampsia, but this has to be a reading after 4 hours, like one or more following the complication after the test of 20 weeks of pregnancy. So let's look at treatment plan. We have treatment plan for pregnancy, and there is no cure for preeclampsia. The treatment plan here is just to deliver the baby. The baby needs to be out if a woman is diagnosed of preeclampsia, because this will lead to a serious fetal complication for both the mother and the baby. So Prevention. How do we prevent preeclampsia? Currently, there is no sure way to prevent preeclampsia, but researchers continue to study ways to prevent it. And they said that contributing factors to high blood pressure, if prevented, could prevent preeclampsia. And what are these factors? These factors can be to monitor the high blood pressure, controlling eating less salt, restricting calories, taking anticonvulsive medication, example magnesium sulfate, that should be prescribed by the doctor, and because it helps to prevent seizure. And low dose aspirin could also be taken, and calcium sulfate, because it is known that pregnant women with low calcium have high risk of developing preeclampsia. And another thing is early attendance for prenatal care. When once a woman is pregnant, it is advisable, it is very vital that they attend a prenatal care immediately. Most so a pregnant woman should avoid alcohol and smoking. What are the nursing interventions? Let's look at the nursing intervention in both for mild and severe preeclampsia. Because of time, we're going to see blood monitor for 4 hours, and the weight of the patient has to be monitored, neurological status, deep tendon reflexes, and presence of clonus, and to provide adequate fluid for the pregnant woman, because dehydration can cause preeclampsia. And then also monitor intake and output of the mother, because a urinary output of 30 milliliters per hour they indicate adequate renal perfusion. Most so, you monitor signs for magnesium toxicity. The reason, if a pregnant woman is put on magnesium sulfate to prevent seizure, definitely as a nurse to intervene, you have to monitor that woman, the pregnant woman, for magnesium sulfate toxicity. Okay, so the reason I made this project is because I so much wanted to go deep into it, but with this video it's not much enough time to say all. So if you want to know more deep into preeclampsia, you can go ahead and read my paperwork. But I have to tell you what I've learned from this research is it means that there is no medication that can cure established preeclampsia. When a preeclampsia has been established by your doctor, like they said, okay, this is preeclampsia, there is no medication or no cure to it. The only treatment is the delivering of the baby. The delivering of the baby. However, medication can be used to control blood pressure, and at least for a time, but the underlying diseases remains, and the risk of poor pregnancy outcomes continue to increase, meaning the early cure to preeclampsia is to give birth either by cesarean section or by induction, induce the pregnancy for the baby to be delivered vaginally or cesarean section. Thank you for listening, and I hope this gave you a little light on preeclampsia. Thank you, and thank you.